Hey there everybody, Luke Gordon here, and today we're talking about the number one mistake that people with lower back pain and sciatica make. So before I get into the mistake they make, I want to give you just a little bit of a background on a patient that we saw just in the last 2 weeks. So Michelle comes to me one day and she explains that about 2 weeks ago she was just rushing to finish up some things around her house, doing some chores, and she bent down to pick up the last load of laundry and she felt something kind of twinge and slip in her back. That followed with severe low back pain, and over the coming days she tried to rest it and it just got worse, and ultimately that pain in her lower back started to spread down one of her legs. So now she's getting pain down the back of her leg into her buttocks, down as far as her knee. We call that pain sciatica. So Michelle does like most people do, and she tries to rest it. She tries to take it easy, and unfortunately over the next week or two her pain just gets worse and worse. So Michelle is a very common patient. And in this case, what she's suffering from is a bulging disc in her back that's putting some pressure on her sciatic nerve, and that's giving her the sciatica pain. So like a lot of people, what Michelle's done wrong, and this is the number one biggest mistake people are making with their lower back pain and sciatica, what she's done wrong is she's just rested and she's tried to take it easy, thinking that her back pain would just go away. Now, with some types of pain that may work, but with this type of pain, especially with a bulging disc, it doesn't work. The other thing that's going wrong there is that Michelle, her primary way of resting is by sitting. And with a bulging disc in your lower back, sitting is about the worst thing you can do, especially because most of us, when we sit, we tend to slouch. And as we do that, that's putting pressure on the disc, and it's putting even more pressure on your sciatic nerve. The other mistake that she's probably throwing in, as well as most people, is that the pain is severe at first, so she's masking it with things like painkillers. So she might have gone to her doctor and gotten a prescription for like hydrocodone, or even just over-the-counter like Tylenol, or your anti-inflammatories like Aleve and ibuprofen. And again, there's a time and a place for those medications, but unfortunately in this case, Michelle isn't getting any better, and those medications are just masking up her pain. So that's the number one biggest mistake, again, is resting. Again, resting can be beneficial for some cases, but in this case, it's the way that Michelle was resting, and more or less, it's not just the fact that she was resting, but she's trying to ignore the pain and just hope that it'll go away. So that's the biggest mistake, like I mentioned, and now we want to talk about, again, so what can Michelle do to improve this? And again, with this type of back pain, there's some very specific things that she can do. So with her pain, the bulging disc and the sciatic pain, the first thing she can do, here's your 3 tips. The first thing she can do is she can avoid sitting for more than, let's say, 5 minutes. Again, prolonged sitting, especially with a bulging disc, is a lot of pressure on that disc, and it's going to end up making your pain worse. Sometimes, and this is the tricky part with sitting, is that sometimes it actually feels good to sit for a little while, but then as soon as you go to stand up, you're just going to feel all of the damage you've done, and it's just going to really bother you. Those are the folks that when they go to stand up, they have to like spend a few extra minutes just getting vertical, because they're hunched over, because that's as far as they can go without putting too much pressure on the disc. So that's your first tip, is avoid sitting for more than 5 minutes. Your second tip is to start very gradually doing some standing back bends. And you can't see me that well in this video, I know, but it's pretty simple. You would just stand up, put your hands like on your hips, and just nice and easy start to bend backwards. You can't really rush this exercise, but it's a good one to do gradually over the course of those coming days, especially after the disc bulge. So just a gradual back bending, just to your own comfort. The third thing is that when you do want to, the pain is severe and you do want to lie down and rest and just take some pressure off it, what you want to do then, instead of sitting or instead of curling up in a ball, like in the fetal position, which is very tempting because again it might feel good temporarily, is you want to lay flat on a firm surface like your bed, or not your bed, excuse me, like the ground, and put your feet up on a firm surface like your couch. If you can do that, you're going to flatten your back out, you're going to decompress it by taking away gravity, and you're just going to let that disc bulge kind of settle back down. So those are your 3 tips. Again, avoid prolonged sitting, start to gradually work on some gentle back bends to relocate that disc bulge, and then when you want to rest, lay flat on your back with your feet up and avoid curling up into that fetal position. So again, this is a very common type of thing we see here in the clinic with the disc bulging causing sciatica pain. The only word of caution I want to throw in here at the end is that when you're trying to treat your lower back pain and sciatica, you really have to know what you're dealing with. In Michelle's case, it was pretty easy for us to diagnose her, with a clinical examination that it was a bulging disc causing her sciatica, and so then we can start to initiate these types of treatments. If Michelle had a different type of lower back pain and sciatica, we would want to know that just so we knew the appropriate treatments to do. So that's your word of caution. Make sure you have a good idea of what you're doing before you start trying to treat it. And if you're not quite sure what you're dealing with, we have several options for you there as well. So we've got our lower back pain and sciatica workshops. We do those fairly regularly every couple months or so. So you're more than welcome to come to those. We talk about the top 3 causes of lower back pain and sciatica. Again, for this video, we're talking about disc bulges pretty much primarily. And then we've also got our free report, our tips report. So the links and the information for those are above in the blog post or below in the blog post if you're watching this on YouTube. So feel free to reach out to us. Again, before you start treating your back pain, you want to know what you're dealing with. So I hope this finds you well, and if you have any questions, again, reach out to us either by phone or by email. I'll leave all the contact information below. So thanks for watching. Have a good day.